Hi, David Liu here from Vienna, EULAR 2024. Some of the highlights from rheumatoid arthritis today. Really interesting abstract from Leeds, from the powerhouse that is Leeds. And they looked at palindromic rheumatism, which is something that I think doesn't get talked about very much. But we do know that these patients certainly make our way in the door. It's often hard to know exactly how to follow up on them. Should we be seeing them frequently just in case they develop inflammatory arthritis? Should we just send them back to their primary care physician and just hope that all goes okay? Where do we sit in between? And it seems hard to be able to pick who is going to be able to be sent back to their primary care physician and who we have to watch closely. So in Leeds, they've been looking at this for 15 years, and they've got 15 years of data that they've been able to compile into a point scoring system to help deal with this for you. So what they've done is in amongst that 15 years of data, they figured out the relative weightings. I'll give you the point scoring system now. So female sex, 2 points, age over 40, 1 point, smoking ever, 1 point, typical interval between attacks is less than 1 month, 1 point. Anti-CCP positive, up to 3 times the upper limit of normal, 2 points. Greater than 3 times the upper limit of normal, 5 points. And then rheumatoid factor positive, 1 point. So that just breaks it out into strata, less than 2, between 2 to 8, and greater than 8. And based on that, you can actually predict who's going to do what over time in their cohort. Obviously needs validation, but in that 2 or less, those people never develop inflammatory arthritis, according to this cohort. And then if you look at the moderate versus the high risk, that stratifies out quite nicely. If you look at it at 1 year, it stratifies out to be about 90% versus 70% in terms of not developing inflammatory arthritis. So that's, 10% develop inflammatory arthritis versus 30%. And then if you go out to 5 years, we're looking at about a quarter developing inflammatory arthritis in the moderate risk group versus over half in the high risk group. So that really gives us an idea of if we can stratify at the beginning, then we can really direct care. And really that's the kind of thing that we would like to see more of. Like to see it validated as well, but this is a really great start. For plenty more about rheumatoid arthritis and everything else at EULAR 2024, you know where to go, rheumnow.com.